Hello, welcome to this Fort Wayne Fire Department short. In this video, we are going to cover assessing a patient's airway. So this is going to be the A in airway, breathing, circulation, ABC. First things first, let's set ourselves up for some success and go over the anatomy and physiology of our oropharynx here. So we have our nasal passageway that connects with our mouth opening here, and those form together all the way back to create our oropharynx, combined with our esophageal opening and our tracheal opening and our epiglottis. So we have two tubes descending down into our body. We have one that goes to our stomach, that is our esophagus, and then we have our trachea that goes to our lungs. Now, at the very top of our trachea, we have this little hinging piece of flesh called our epiglottis, and that serves as kind of like a trap door into our trachea to make sure that things that should be going down into the esophagus do not accidentally go down into the trachea. So, first things first, when we are assessing a patient's airway, if they are speaking with us, that tells us that that airway is at least patent. Now, when it comes to the rest of their respiratory status or their ventilations, that is a whole different story. Just because an airway is patent does not mean someone's breathing or that they're breathing well. But if they're talking to you, their airway is patent at that time. What if it's not patent? How are we going to open it? Well, there's two main ways. There is the head tilt chin lift, where we are going to tilt the head, the very top, back, and the chin up and forward. When we do that, that is going to take this epiglottic opening and it is going to force it open this way. So again, the head tilt chin lift, we are going to tilt the forehead or the top of the head back, and then we're going to tip the chin up or forward, and that is going to force that epiglottic opening to manually come open so that that trachea has a wide patent hole here. Now, for example, what if they have a spinal injury and we don't want to manipulate that neck, or we want to minimize the movement that we are causing to that spinal column? So we're going to want to use a different method, and that's what's called our jaw thrust. So using our jaw thrust, we are going to not manipulate the head, but we are going to manipulate the jaw specifically. And so when we are doing that, you are going to place your fingers at the base of the mandible, and you are going to pull up and towards you. And what that is going to do, again, that is going to misplace this epiglottic opening so that it is now in a position where that trachea is patent and open. And that's how you assess a patient's airway and open it.